Who's on your mind right now? Who are you thinking about?
So, I, and out here, I do think about those who are vulnerable, and of course, that's the elderly and those who are without economic means to meet whatever those basic needs are. They are on my mind, but also those who I've left behind. And as I think about them, something that came to mind, right? Just hearing in the news about where shortages are, right? And shortages in, for example, sanitizer, or a shortage in masks and the likes. And I thought about those who are in prison, who are some of the most ingenious people that I know, right? And I have absolutely no doubt that there's folks on the inside who found a way to design their own masks.
Hmm.
And as I thought about that, I also thought that there will be some correctional officers who will see that and kind of smirk and smile at it and keep it moving. And there's others who will respond to that as if it's a threat
Contraband.
and contraband
Yeah.
and confiscate it. And that just speaks to the oppressiveness of our system, and that you can't even exercise your own sense of creativity in those circumstances, which is whether they will need masks or not. It's something to manifest agency,
Mm.
also a coping mechanism that undoubtedly people will be stripped of. But I also think about, in the same way, those parallels of those who are on the inside who don't have family, who don't have supports, and in many cases are dealing with mental or emotional instability, and
Mhm.
how being placed, the DOC's Department of Corrections way of responding to crisis like this is often to put the institution on lockdown.
Yeah.
And so that just means isolation, right? Whether it's in a sense of solitary confinement or even having a cellmate. Isolation is the response. But what that also means is that now you no longer have the ability to look out and facilitate for those who don't have.
Yeah.
So in a situation where either you have or you don't.
Mhm.
And it makes me think about, again, how people are vulnerable in that way out here. Um, and unfortunately, in this particular instance that I referenced earlier, I can't contribute in a way to address a need. And it made me thought about it on those on the inside who are similarly as such, those who have means and capacity, but because of what the response is, don't have the ability to reach out to those who
Mhm.
are in need. So again, that thing about our shared humanity and
Mhm.
what makes us human, um, being sociable, being amicable, um, looking out for the needs and the concerns of one another, in some ways are being stripped from us, both on the outside as well as on the inside. So I hold those in the inside um, dear to my thoughts, my prayers and hopes and aspirations, because I think many of them, especially the elderly and the vulnerable, can and should be released,
Yeah.
because they pose no significant risk to public safety be to be released. And beyond that, it's just not only the moral and the right thing to do. It's indicative of what we've created laws to do, in the sense
Mhm.
of compassionate release,
Yeah.
and yet we rarely, seldomly use it in opportunity in certain circumstances that warrant it.
Right. Well, and it's the safest thing to do for everyone involved, right? I mean, our jails and prisons are extraordinarily overcrowded. guards and folks on the inside alike are being put at unnecessary risk because
Absolutely.
of the number of people we have incarcerated.
Absolutely.
And now, it's, and then guards families, and I mean, it's a public health risk, and it's a public health crisis, really, in the that we have so many people incarcerated, who many of whom don't need to be there, many of whom could be on home confinement or released outright. And they don't have, while they're there, I mean, I think what's interesting that we were just saying is, like, your thought about what's going on the inside is folks looking out for one another, the way we're
Right.
trying to do here, because you have to there, because
Mhm.
people don't, and you have to come up with the mask, you have to come up with the hand sanitizer, because there is a shortage of soap and
Indeed.
hygiene products in prison that right now is making it even more problematic. I mean, I remember this from when I used to monitor the LA County jails. People would holler at me, crying out for help because they needed toilet paper and they were sleeping next to leaking toilets. And I mean, it was just one of the most wretched places any person could. I mean, people shouldn't be housed there, period, but in these overcrowded conditions, it's even worse. Illness spreads rampantly, and people don't have the same, they can't shower when they want, they can't get the soap that they need, they can't wash their hands like we're all doing with our singing happy birthday twice with as much suds as we can possibly get. They have no control over that. And social distancing, and it's like, if you're in a cell with three other people, there's only so much in a the size of, in a room the size of your bathroom, there's only so much distance you can get. And having no control over any of that,
So
it comes down to people looking out for one another, right?
indeed. And you touched on something that's like so critically important, because part of that is, yes, the material resources, but there's the other underlying issue, probably the greater issue, which is the structural issues, right? Um, that no amount of hand sanitizer or toilet paper or masks even um, could ameliorate. There are certain structural issues in terms of, like, inadequate ventilation, right?
Mm-hmm.
Inadequate filters, which once a virus does enter, it
Yep.
just circulates throughout the whole
Right.
institution, right? That's a structural issue. When you talk about, like, contaminated water and just the close proximity because of prison design and overcrowdedness, those are all structural issues. And so, yeah, not only materialistically um, are there shortages, but there are also structural issues that make the spread of any disease more communicable, just because of the design and the overcrowdedness and the structure of prison itself. So
And
that's
then there's the stress that they have, that's, the stress we have is only compounded in there, right? Like, it's only worse. We have the ability to go for walks, to get fresh air. That's where we started the conversation, talking about what the weather was like, because it's so important to us right now. They don't have the ability to go outside when they wish. I mean, if they're locked down, they may not be going outside at all.
very
And so the stress of it, I mean, just brings me back to your wisdom around how you stay um, calm in these moments, and how much individuals in prison are forced to endure, and how much they have to uh, you know look inward and to one another, to survive. And I'm mindful that they're so much in the center of my mind and my heart right now. And um, as well as those who are getting ill, the medical treatment. We didn't even get into the terrible medical treatment, underfunded, under resourced medical treatment in prisons. But what needs to happen is there need to be fewer people. They need to be releasing people. They need to be moving through parole hearings by video. They need to have judicial hearings by video, because there are plenty of people that we know who are eligible for relief under a range of different kinds of laws and reforms that make people eligible for resentencing or parole, and they need to get access to that through through video in this moment, because there's people who are sitting there who pose no risk, people like you, Abd'Allah, who are fine humans, who are better off in society. Society is better off with you here, and they're sitting in prison, extraordinarily vulnerable and exposed to this. So people need to take action. Call governors, call your governors, call your local mayor. The jails are crowded too. I mean, and that's where you're, you know, that's at the city county level. Call the district attorney's offices. We have got to prioritize acting on behalf of these folks. But I just want to, you know, close with gratitude again to you, Abd'Allah, for constantly being willing to share so much of yourself, give so much of yourself for others, for being open and sharing your wisdom about how to survive these chaotic times based on the torturous and chaotic times you've had to endure. I'm sorry you had to endure them. And I'm deeply, deeply grateful to you for being willing to share so much of yourself with me and with others.
And I thank you again for the opportunity, for the dialogue, for the discussion, but even more than that, for your leadership, not just with the Campaign for Fair Sentencing of Youth, who I'm just incredibly honored to work for, but also for your leadership in humanity and what that means and how you teach us all to be better people. And just a closing remark that we don't allow our empathy and compassion for one another to be subjected to geographical borders or artificially constructed borders, even domestically, and that our empathy and compassion is to those in our communities, our families, but also those who have been disappeared from society and who languish behind gates and fences and walls as well, equally deserving of our empathy, compassion, and they too have a right to redemption and resources. So thank you very much for lifting this up. Deeply appreciate it.
Thank you.